Hello friends, today continuing the next topics, white white sponge nevus. It is autosomal dominant inherited disease and it is characterized by large white plaques in the oral mucosa with preferential involvement of the buccal mucosa. This is shown in the figure. This is the white plaque in the oral mucosa, and there is a mutation of the keratin 4 or 13 genes which are expressed in the malpighian layer of the mucosa. Microscopically, there is striking intracellular glycogen accumulation. Microscopically, there is a intracellular glycogen accumulation throughout the layer with overlying parakeratosis. This is the microscopic picture showing the accumulation. This is the accumulation, and there is a pallor of the cytoplasm due to the intracellular edema. Next is Fordyce granules, refers to the presence of normal sebaceous gland inside the oral cavity. Very common occurrence. There is a presence of normal sebaceous gland in the oral cavity. Okay, now moving to the inflammatory diseases. Chronic inflammatory lesions of non-specific type are produced in the oral cavity. Non-specific type chronic inflammatory lesions are produced by first ill-fitting denture, ragged sharp teeth, poor dental hygiene. Removal of the offending agent allow the pathologic process to subside. Microscopic, there is a combination of hyperplastic epithelium including pseudoepitheliomatous hyperplasia. Fibrous tissue and inflammatory cells in varying proportion is seen. Next inflammatory is geographic tongue. There is a benign migratory glossitis, also known as glossitis migrans, and it is a relatively common condition affecting 1 to 2% of population of unknown cause and is usually asymptomatic. Clinically, it appears as an erythematous flat zone on the dorsum of the tongue. How does it appear? Erythematous flat zone on the dorsum of the tongue as shown in the figure. This is the geographic tongue showing the erythematous plaque. Erythematous zone. Microscopic appearance is that of psoriasiform process in which there is acanthosis with migration of neutrophils throughout the epithelium to form the microabscess near the surface, accompanied by mild inflammatory infiltrate in the lamina propria. As we see in psoriasis, this is also seen in here. Next is tuberculosis, which is very rare in the oral cavity. It is usually seen on the tongue as a painful ulcer, but may also occur on the buccal mucosa. Syphilis may produce a goma in the tongue or palate appearing as a painless indurated mass. Next is histoplasmosis. It can occur anywhere in the oral cavity and can closely simulate squamous cell carcinoma on clinical examination. Indurated ulcers, nodular lesions, or varicose masses can be present. Usual microscopic appearance, there is a granuloma formation along with a non-specific inflammatory reaction. Special stains like gomorymethamine silver or periodic acid Schiff are necessary for identification of the fungi. Moving to the sarcoidosis, may affect oral mucosa, gingiva, tongue, hard palate, and major salivary glands. And in sarcoidosis, as we know, there is a non-caseating granulomas. Another is Melkerson-Rosenthal syndrome, in which there is a triad of orofacial swelling, peripheral facial nerve paralysis, and plicated tongue. This is a microscopic picture with a patient Melkerson-Rosenthal syndrome, and we can see the numerous known necrotizing granulomas below the normal epithelium. Other known neoplastic lesions, main is oral submucosal fibrosis, as seen mainly in Indians and Pakistan, is a reactive process characterized microscopically by subepithelial fibrosis and chronic inflammation, accompanied by hyalinization and loss of vascularity. There is below epithelium fibrosis and inflammation. Overlying epithelium may be atrophic, hyperplastic, hyperkeratotic. Disease is thought to predispose patient to the development of squamous cell carcinoma. Next is a mucocele. Mucocele is of two types: extravasation mucocele and a retention mucocele. Extravasation mucocele and represents a focus of stromal reaction to spillage of mucus. There is a focus of stromal reaction to spillage of mucus from a traumatically injured minor salivary glands, and it's often seen in young individuals, and the main location is lower lip. And microscopic pattern is that of granulation tissue surrounding one or more spaces containing mucin,